I'm Tash Brusco. I'm the Rehabilitation Stream Lead for the Rehabilitation, Ageing and Independent Living Research Centre. Rehabilitation, it's a journey, an individual journey for each person. It's focused on improving wellbeing and function and involves a diverse team. To me, rehabilitation, it's about understanding, adapting and returning to a life which is meaningful to you.
Right now, I'm working on a TAC-funded study on the use of telehealth in rehabilitation for survivors of major trauma. So we're asking patients, healthcare professionals and TAC staff about what's good and bad about telehealth. And because TAC didn't provide telehealth billing codes prior to the pandemic, we're also going to look at the uptake across the state since last year. But also through data linkage, we're going to investigate the effectiveness and cost effectiveness of telehealth. And the findings of this research will be available in the second half of 2022.
And another piece of research we're working on is called the My Therapy program. And My Therapy is all about empowering the patients to be an active part of the rehabilitation process through self-management. So to augment the traditional supervised therapy that people receive from their occupational therapist and their physiotherapist, we're actually adding to it a self-management program. And it's designed to empower the patient to have a sense of control over their therapy journey as they go along. So this program will also hopefully increase the dose of participation, because we know that in rehabilitation, for the inpatient setting, the more you do, the better your outcomes can be. And this relates to your quality of life and your function. And so we're going to aim to increase that dose of rehabilitation through that process as well. The feedback that we've had to date from the patients has been quite positive, and that suggestion of feeling empowered and feeling in control of an element of the rehabilitation process. The program will continue through until May of next year, and it's being conducted across 4 hospitals at the moment. We expect the results to be available around the end of next year.
I'm working in a project that involves the investigation of the role of walking aids in improving walking and stability in people with dementia. This project is funded by Dementia Australia. The different phases of this project has involved multiple participant groups, such as people with dementia, informal carers, hospital-based and community-based health professionals, and care support workers. We have also engaged several industry organizations to work with us in this project. This project has started since 2020 and will finish in 2022.
That I've learnt since joining Rail is just how much learning there is to be had across the 3 streams of Rail. For example, in the Rail Narrative Project, it was so interesting hearing from people with disabilities in the independent living stream about what rehabilitation meant to them, and the importance of considering the notion that rehabilitation is not always about returning to where you were before, and so needing to look carefully at the use and the definition of that word. In terms of ageing and rehab, one thing I've learnt more about is person-centred care and the importance of this for older adults undergoing rehab in order to ensure that everyone is given the opportunity to achieve their rehab goals regardless of their age or ability.
Particular to our rehabilitation research, I've been leading some work looking at the use of existing but also emerging technologies for executive function support after brain injury. So executive function is that remembering, planning, organising or initiating everyday activities. And we've been working to explore products that are emerging and thinking about how they can be utilised to support executive functioning. An important learning from that has been really looking at those good practice principles of assistive technology provision. And that means that we've really started with a focus on what are the goals of the person in their everyday life and their rehabilitation, and what are the range of ways those goals may be met. And then we've worked to identify if there may be a technology solution that could assist them. But an important learning has really been starting with the person and their goals rather than starting at the product end of technology. And that's been really central to the approach we're taking in this research work.
So the potential impacts for the rehabilitation stream are really looking around those effective and cost-effective models of rehabilitation, and again focusing on the client-centred goals and having the patient centre to the process and ensuring that they feel empowered to take some sense of control with their journey throughout rehabilitation.